from heart attack and stroke is a rationale for changing the way Lipitor and other cholesterol-lowering statins are used. The new guidelines instruct doctors to stop trying to meet strict target numbers for lowering LDL or bad cholesterol.
Almost like 294. You know, it was high, it was up there.
Miriam Garcia is a med tech type 2 diabetic and among the estimated 36 million Americans currently taking statins, those with a 1 in 5 chance of having a heart attack in the next 10 years.
Any muscle pain?
Cardiologist Dr. Bassem Masri is the director of cardiac disease prevention and cholesterol research at Weill Cornell Medical College. He says the new guidelines create 2 categories of patients: high risk and medium risk.
If you have somebody who is at high risk, you cut down his cholesterol, whatever is the baseline, by 50%. Somebody at moderate risk, you cut it down by 30 to 50%.
The authors of the guidelines have also come up with a risk calculator for doctors to use, one that not only looks at cholesterol levels, but also considers age, gender, blood pressure, smoking, and other variables. Dr. Masri says if risk factors add up to a 7.5% chance of a patient suffering a stroke or heart attack, the new guidelines advise statins. He says he's not 100% on board with the recommendations in general, and other doctors may be slow to accept them as well.
The cardiologists, most of them are proponents of lower LDL and lower number. So if they're going to continue thinking this way, then they will stick to the old guidelines.
Statin patient Miriam Garcia says she's not sure how the new guidelines will affect her treatment, if at all, but her cholesterol is coming down.
And now it's at 134, which is very good.
Roseanne Coletti, News 4, New York.
Coming up next here on News 4.